Before inserting a nasogastric or NG tube, check the provider's orders to verify the type of tube to be inserted. Review the patient's medical record for a history of basilar skull fracture, nosebleeds, septal deviation, or other nasal problems, and coagulopathy and anticoagulation therapy. Perform hand hygiene. Gather your equipment and ensure privacy. Introduce yourself to the patient and identify him using two identifiers.
My name is Jennifer. I'm going to be your nurse today.
Good morning.
Can you state your name for me, please?
Greg Wilson,
All right, and your date of birth.
1856.
All right, thank you.
Explain the procedure to the patient and assess his cough and gag reflexes.
All right, I'm going to assess you for a few things before we get started. I would like you to cough for me, please. Very good. And then I'm going to assess your gag reflux. Thank you. Sorry for that discomfort.
It's okay.
I'm going to raise the head of bed for you now.
Place the patient in the high Fowler's position unless doing so is contraindicated by his condition. If he's comatose or confused, raise the head of the bed and ask an assistant to help you place him in the semi-Fowler's position. If he must remain supine, place him in the reverse Trendelenburg position. Affix a pulse oximeter and take his vital signs.
Rest your hand down. All right, thank you. And then I want you to close each nostril and blow.
To assess the patency of the patient's nares, have him hold each nostril closed in turn while breathing through the other. Assist him if needed. Place the tube in the more patent nares. As a safeguard, tell the patient to raise his index finger, if necessary, to let you know if he's gagging or feels uncomfortable during the procedure.
All right, I'm going to measure the tube now.
To determine the length of the tube you'll need to insert, measure from the tip of the patient's nose to his earlobe, and from his earlobe to the xiphoid process. Mark that point on the tube with tape or indelible ink. Continue preparing your supplies. Set up your syringe with water and squeeze the water-soluble lubricant out for the tubing. Apply clean gloves and inject 10 milliliters of water into the tube using a 30 to 60 milliliter irrigation syringe. If you're using a stylet, make sure it's securely positioned within the tube. If the tube has a surface lubricant, dip the tube into a glass of room temperature water to activate it. For other kinds of tubes, apply a water-soluble lubricant according to the manufacturer's instructions.
Tina's going to come in and help us with the procedure right now.
Okay.
Tell the patient you're about to begin.
She's going to be in charge of making sure that you drink the water whenever we need you to as we're inserting the tube, okay?
Okay.
We're going to get started.
Then gently insert the tube through one nostril to the back of his throat. Aim back and down toward the ear. As the tube passes the nasopharynx, have the patient bend his head toward his chest. Encourage him to swallow by giving him water or ice chips. The goal is to advance the tube down the esophagus. Once the tube has been advanced 25 to 30 centimeters, stop and listen for air escaping from the tubing. The presence of air indicates that the tube might be in the trachea rather than in the esophagus. If air is present, withdraw the tube and start again. If there is no air, continue to advance the tube to the distance marker.
All right, Tina, if you could help me hold the tube now, I'd appreciate it, please. Open your mouth, please.
Check the position of the tube with a light and tongue blade. If you're satisfied, temporarily anchor the tube to the patient's nose. Some systems require an anti-reflux valve to close the open tube. Verify correct placement of the tube by aspirating stomach contents and checking pH. See the video skill Managing a Nasogastric Tube.
Just going to mark the tube.
Mark the exit site on the tube with indelible ink. Then secure the tube to the patient's nose.
Now I'm going to put some tacky adhesive on your nose so that
To use tape, apply tincture of benzoin or another skin adhesive to the tip of the patient's nose. It should feel tacky. Remove your gloves and tear a 10-centimeter piece of hypoallergenic tape. Then at one end, split the tape about 5 centimeters.
I'm going to place it on the bridge of your nose now.
Place the intact end of the tape over the bridge of the patient's nose. Secure the ends of the new tape out of the way while removing the temporary tape.
Carefully take this old one off. Thank you for holding so still.
Wrap each split end in opposite directions around the tube where it exits the nose.
All right, now the other side here.
Another, smaller piece of tape may be applied over the bridge of the nose.
Just like that. All right, I'm just going to adhere this onto your cheek, okay?
To use a membrane dressing to anchor the tube, apply tincture of benzoin or another skin adhesive to the patient's cheek and to the section of the tube you wish to secure. Place the tube against the patient's cheek and use the membrane dressing to anchor it out of his line of sight.
All right, now I'm just going to tape it to your gown as well.
Okay.
Fasten the end to the patient's gown using a clip or a piece of tape. Don't pin the tube to the gown.
Just like that. Can I get you more comfortable right now?
Help the patient into a comfortable position. For definitive confirmation of correct tube placement, obtain a chest or abdominal X-ray.
All right, we're going to do some oral care now to hopefully make you feel a little better.
Okay.
Sir?
Wearing clean gloves, provide oral hygiene.
We're going to clean up around your nose a little bit now for you, sir.
Clean the tubing at the nostril with a damp washcloth and mild soap. Dispose of your used equipment.
Call me if you need anything.
Remove your gloves and perform hand hygiene. Document the insertion, including the centimeter at the nose line, that placement was verified by X-ray, and how well the patient tolerated the procedure.